Hi there. Now we're moving on to Chapter 18, Section 3, the female reproductive system. Now, like I mentioned before, the female's body is extremely evolving. There's more to our body, to female's body, that goes on than males. So, women's body, you have ovaries, you have fallopian tubes, you have a cervix, you have a bladder, of course, you have the urethra and the vagina, and you have uterus. So a lot of things are happening. When you are a little girl, okay, you have eggs in you, but you're not ready to have a child, of course. And you have estrogen and progesterone, which are hormones in your body, and you also have testosterone. So you have 3 different types of hormones in your body. And when a girl is on her period, her egg goes through ovulation. So you're going to be reading about Section 1, the first part of Section 3 regarding the structure and the function of the female reproductive system. You will learn the purpose of the fallopian tubes, the purpose of the uterus. The uterus is also known as the womb. So like when the woman does get pregnant, the baby's not in the mom's stomach. It's really in the uterus. So you'll learn more on that. Then you have the vagina. And on page 470, there are a frontal view and a side view of the woman's internal sexual organs. Now, the male, his sexual organs are external. The woman's sexual organs are internal. So a lot of times when it comes to STDs, sexually transmitted diseases, unfortunately, a lot of women don't know they have it because everything's usually internal. If a gentleman had an STD, of course, if you choose to abstain from any forms of sex, any of the 4 forms of sex, you would not have that problem about STDs. But for gentlemen, for men, if they had genital warts or any other form of STD, they would probably see it on their penis area. But whereas a woman, a lot of it's all internal. Most of it's all internal for any STDs. If it's external to the point where you can see the STD when you're like going to the bathroom or what have you, or you're cleaning yourself, then you definitely know it's been inside your sexual organs for a very long time. So you want to look over the 2 diagrams on page 470. Then you're moving on to menstrual cycle. So that's like your monthly period. All right. Every woman goes through this. The thing that we all have in common is we all understand that it's not a comfortable situation. It's annoying, to tell you the truth. Every girl goes through this, but at different stages in their life, in the sense of like some girls nowadays, 10, they have periods when they're 10. You might have your period when you're 15. A lot of times when girls are later having their period, like 14, 15, it's because maybe they were very active. A lot of times when you're an athlete, sometimes that suppresses your period. But average now is girls getting their period in like 5th, 6th, and 7th grade. So by the time you're 15, 16, you should have already had at least 1 year worth of a period. If that, I mean, depending on, again, like I said, if you were been an athlete or you're very very active in the sense that sometimes your period withstands that. But there's a lot of factors that go on with the period. Your body changes, and hormonal wise, you get kind of irritated, you gain some water weight, you have emotional feelings of highs and lows, like you feel happy, then you feel sad. But when you're on your period, it's a natural thing that happens to females, all right? So you're talking about the menstrual cycle, the factor of that. You want to make sure that you understand the time frame when a woman has her period. So it's like a 28-day basis. Of course, there's 30, average 30, like 31, so average 30 days in a month. So if your period is a whole process of 28 days, there's only 2 days that nothing's happening to your body physiologically. So that means there's just 2 days that you feel normal, all right? Either you're on your period, you're getting ready, so either you're on your period or you're getting ready to have your period, or you just got done with your period. So that's why the cycle comes in effect. You want to make sure that you understand the hormones, FSH and LH. Those are hormones for females. So it talks about like the releasing of the ovaries. And then, of course, there's menopause, where when you reach a certain age in life, like some people would say, my mom or my grandma or my aunt's going through the change of life. They have hot flashes or whatever, or they're just really emotional, or they're not themselves. Well, that's because you're lessening your hormone of progesterone and or estrogen. Most likely it's estrogen. So you want to make sure, more likely it is estrogen. I want to make sure on that. That what we call menopause. And the average age is like 50, 55, but some women are going through premenopause, which is in their mid 40s. So you have premenopause, then you have menopause. And usually that's when like the woman stops having a high production of eggs, okay, and she is lacking estrogen, and she will go through like hot flashes like I mentioned earlier. And eventually the woman, when she gets older, she will not have any more eggs or less eggs, so her childbearing years are lessened. So on page 472, it literally shows you the diagram regarding the menstruation cycle. So it tells you days 1 through 4, where the urinary lining is shedding the blood off the wall of the uterus. Then you have stage 2, which is days 5 to 13. This is when your ovaries are leaving the urinary lining and it thickens. Then you have stage 3, days 14 to 15. This is when the egg is maturing, and this is the prime time when the woman is fertile. So this is when the egg, or the ovum, because an egg is also called the ovum, leaves the ovary, and it's basically ovulation is occurring. So you may feel a little flutter, you may feel nothing, or you may feel a really major pain on one side of your stomach area, lower abdominal area, or the other side. But sometimes you may not feel anything, okay? And sometimes it alternates sides, or it's just always the same side of the ovary. There's 2 ovaries in your body, ladies. And if for some reason there is no sexual intercourse, then the egg will break down, and it'll break down into cells, and then of course your period will start. So days 16 to 22, the egg travels through the fallopian tube, and then it travels down the fallopian tube down to the uterus. And again, if it does not get fertilized by the sperm, then the egg just breaks down, and then the blood from the vagina will come out. And then of course the final stage, 23 to 28. If the egg is fertilized by a sperm, then the egg will plant itself in the urinary lining, and then, of course, the child will be developed. So again, you want to make sure that you're looking through the stages of 1 through 5 of the diagram on page 472. So stages of menstrual cycle. It's very important to know that. You're going to feel discomfort when you're on your period. Again, you feel bloated. You got to change your pad or your tampon. And girls, you do not want to go to bed with a tampon, no matter if it says the box says you can. You should not do that, because you can get an infection, and there are other complications could occur from that, like toxic shock syndrome. So you want to make sure that you are wearing a pad. Anytime that you are wearing a tampon or pad and you're going to the bathroom, you should change that. All right. The toxic shock syndrome, again, like I mentioned, that's when you're not changing your tampon very often. So you need to make sure you change that and do not sleep in that. And if you're not comfortable using a tampon, you don't have to use a tampon. It's totally fine. It's your choice. All right, going to page 472, you have keeping clean, your cleanliness. You want to make sure, like I mentioned during the boys, when you're taking a shower or whatever, you want to be aware of your body. You want to know if things are going properly or not, in the sense of like if you've have a lump on your breast or your vaginal area, if you are bleeding abnormally, okay, if you may have an ingrown hair, in your vagina area, and you're not sure what it is, you got to be aware of that stuff. So again, you want to do self-exams on yourself. You want to make sure that if you have any questions, you should go to an adult that you feel comfortable with. Usually it's a female that you may feel comfortable with, or the male, if you feel comfortable on that, or your family doctor. Okay, so again, it's very important to clean yourself thoroughly. Hygiene is important for both male and females, regardless. Hygiene is very, especially because you guys are teenagers, you're going through hormones, so you want to make sure you're clean. Medical checkups. Okay, so over on this portion here, the end of section 3, it talks about mammograms. So that's when they're checking your breasts in case you may have any lumps in your breasts. The machine's not very comfortable, to tell you the truth, and that usually doesn't happen until like later on. I don't know. I want to say I probably in my mid-20s, maybe. I don't know, but it all depends on the individual. But usually I got mine in my mid-20s because I might have had some complications, but I'm fine. But usually it's in the 35s and 40 age. But again, if you felt a bump, you need to go to your family doctor. And it could be nothing. It could be just a gland that's swollen. But usually it doesn't happen until like when you're in your 40s. And then you have a pap smear, which the OBGYN, which is like a gynecologist, female doctor that specializes in the female reproductive system, would examine your uterus, okay, and your cervix area. And that doesn't happen all the time when you go to family, when you go to your OBGYN. There has to be reasons why they're going to be given a pap smear on you. And again, you need to talk to your parent or guardian regarding that issue. So you do have some issues, though, when it comes to maybe getting a pap smear. You could have some cysts in your ovaries. And I've never felt one before. I never had one before, but my sister had, and another friend of mine, and it's major pain. I guess they said it's excruciating. So they had to go and get those cysts removed. And then you have endometriosis, which is a portion where you have issues with your urinary lining. So here, it's a condition where the line of the uterus, it gets like, it's like scar tissue. Okay, and a lot of women have a hard time getting pregnant with endometriosis, and you can become infertile, but some women, if they do get pregnant, it's a at-risk pregnancy, and it's very painful, what people tell me, if they have it, and sometimes they have to have surgery on that. So again, that's another issue that us women go through, some women. Then you have infertility. So if women who may not be able to have children, it would be many, many reasons. There could be scar tissue in the fallopian tube. You can have a low ovary or egg count. You can have complications because of endometriosis. My sister had major issues trying to get pregnant because she wasn't producing enough progesterone when she was pregnant. And then I had another good friend of mine who had multiple miscarriages because her body wasn't producing enough calcium. And she would only have her baby to like second term. So it was really, really sad. And yeah, it's very sad. Speaking of experience, I've lost one child before. So there's many reasons why of infertility. And of course, the older the woman gets, it may be harder for her to get pregnant. So you're going to be doing section 3, the questions 1 through 5. Make sure you go over all the stages of the reproductive system for the female, the 2 diagrams. Make sure you go over the menstruation cycle. Know that when the ovaries are leaving the fallopian tube, when menstruation is occurring, like the whole cycle. Make sure you understand that there's progesterone, estrogen, and testosterone in the female, and also that days 14 and 15 are vital when the woman's on her period, because that's when she's extremely fertile, and that's when her egg is ovulating. Okay, so I will talk to you guys later. Take care.